So welcome everyone. My name is Sarah Martin. I'm the GBV AOR Community of Practice moderator, and I'm your host of the event today. The GBV AOR Community of Practice is a virtual network for GBV professionals that we've created to help mentor and support each other. So on the Community of Practice, we share materials and resources, but we also help each other try to feel a bit less alone in our work. And we try to support each other through all the many challenges that we face in gender-based violence work. 2020 has been an extraordinary year for the whole world. And in the gender-based violence world, we've had, the shadow pandemic of intimate partner violence and more challenges and stress than our normal stressful and challenging jobs. And since so many of you have been having to go through this yourselves, we thought we wanted to try to take a breath here as we get towards the end of 2020 and here during the 16 days of action to think about our own staff and our own gender-based violence practitioners and the work that we do and how we can better support ourselves and provide care for ourselves. So we pulled together some pretty amazing women to come and talk to you today about this topic. And we want to introduce specifically the minimum standards. Next slide, please, Shiva. So my colleagues Philippe and Shiva with the GBV AOR comms team are helping us out on that. So thanks for that. And thanks to our interpreters and UNICEF for supporting us on this technical side as well. So what we're going to do today is, here's our agenda. You're going to hear from a number of different AOR organizations, and there will hopefully be time at the end to ask your questions. So please do put your questions into the Zoom format. I'm going to give you just a very brief overview of the minimum standards, just to orient you. And then we're going to delve in deeper into why staff care and supervision is such an important topic and what we actually mean by that, by supervision and community support. We're going to highlight a few initiatives that some of the GBV AOR members are undertaking to address the minimum standards around staff care. Now, this is not the last time you'll hear about this. We envision this as being kind of the first installment in a series that will address the topic of staff care and burnout. And we want to talk more about this in the community of practice in 2021. So if you're interested in sharing more about your work or how you're putting the minimum standards to work or what you've been doing to support your staff care, we would love to hear more from you. You can write to me at gbvcop@gmail.com, and we'll put that in the chat box for you. And let us know if you want to share your work. I'm hoping through 2021, we can continue this focus on the minimum standards on staff care. And we can, do more activities, maybe not webinars. I think people are feeling quite a webinared out, but maybe some podcasts, some videos that you can watch, other just ways that we can get together and support each other and talk more about this topic. Next slide, please. So here for the 16 days of action here at the GBV AOR, we decided to focus on making sure you all got a chance to really look into the interagency minimum standards for GBV and emergencies programming. If you haven't checked it out yet, on the AOR website, we put together a special page for you can go to at www.gbviems.org, and we'll put that in the chat as well, where you can download videos, including the introductory video we did about the minimum standards, discussions, self-care tools, other things to help you better understand the minimum standards. And this is going to stay up, for some time. And we do have everything in French, Arabic, and Spanish up there, as well as English. So this is our focus this 16 days, and we hope that you're finding it helpful. Next slide, please. So why we're all here today is to talk about Standard 3, which is on staff care and support. Okay, next slide. So Standard 3 is what we would call one of the foundational standards, like as if you were doing a building foundation. It is the thing that we build all the rest of our work off of. And in gender-based violence work, we know that our staff are the heart of our work. They're the ones that we build everything off of. So we're highlighting them and the need that they have for care and support as a way to ensure that our programs are of good quality. Next slide, please. So in this standard, when we're talking about staff, it's not just paid staff. In the GBV program team members, it's all of them, regardless of their employment status. You know, in so many of our programs, this includes volunteer staff or, you know, the people in the local organizations, the women themselves. There's a lot of people who fall under the umbrella of staff. So just a note on that. Next slide, please. So we're going to hear more from Alina Potts about stress and how GBV workers experience it and how it can lead to burnout or vicarious traumatization. It's important that we focus on this topic. You know, working in gender-based violence can be very difficult. Gender-based violence program staff face issues that many other humanitarian aid workers don't necessarily. We have direct contact with survivors. We're hearing about violence quite often. Sometimes we're even experiencing violence, both in our personal lives, but also through the work that we're doing. And this impacts us. We're also a predominantly female-oriented sector, and we know that women and girls, 1 out of 3 women and girls globally face gender-based violence, so that there's a very good chance that some of our staff or our colleagues themselves are also facing these things. And sometimes you can feel quite alone in fighting for this topic, caring about this topic, and working on this topic. It sometimes can feel really overwhelming and exhausting. So it's important that we have a plan to address how we work with our staff to make sure that they don't feel alone and that they don't burn out. Next slide. Inbal Sansani, who's the author of the minimum standards, is going to try to join us today to be in the chat. And she can answer your questions if you have some about what we mean by duty of care. And I'm hoping that we'll have a podcast or another event to dive deeper into this topic with her, because it's really a rich and interesting topic. You know, all humanitarian organizations, it goes without saying, ensure the physical health and safety of our staff. We have mandatory security trainings. We have to take vaccines before we deploy to new countries. We've got security officers who design regulations to keep us safe. But our psychological safety and health is a newer concern. I myself went through a burnout about 6 years ago when I was working with Médecins Sans Frontières, MSF. And I was very grateful that they had a plan in place to be able to support me through that, because it's a really exhausting and terrible thing to go through. As GBV staff, you know, we face these additional and unique safety risks. So for these reasons, organizations have a legal and moral obligation to protect and enhance our safety and our well-being. So this idea of duty of care is something that's...
le bien-être de leur personnel.
Next slide, please.
العرض التالي.
So who's responsible for this?
من هو المسؤول عن هذا؟ المسؤول هم المدراء.
Sustaining a healthy work environment. This is why this standard emphasizes the important role of GBV program managers in sustaining a healthy work environment. So what does organizational support look like exactly? Well, we're going to hear from Traumatization, from NCA, from UNFPA, the GBV IMS team, and our colleagues at the AOR about different ways that they're approaching this. So we're hoping that this is going to give you some ideas and help stimulate you. And again, we're really looking forward to continuing this discussion on the community of practice and into the new year. So that being said, without any further ado, next slide, please. I would like to turn it over to Alina Potts and ask her to talk to us a bit more about why this is so important.
Sure, thank you, Sarah. So welcome everyone. Thanks for joining us today. I'll dive right in because I want to make sure we can hear from all the great speakers assembled. So we can go to the next slide. So this is a quote from the Southern African AIDS Training Program, which many of you may be familiar with, from their counseling guidelines on domestic violence, that speaks to the issue of burnout. So they say helping clients deal with physical abuse, sexual abuse, or HIV infection is emotionally draining. Issues that surface during counseling may address painful or unresolved experiences of the counselor. Counselors often experience emotional burnout, depression, and difficulties in their own relationships. So this, you can see it's from 2001 and really speaking to many of the issues that Sarah just brought up in her introduction. Next slide. So what is burnout? This is one way we can think of burnout as a kind of job stress common among those who work with others, particularly people in distress. So we often say the helpers or the carers. So people like social workers, psychologists, nurses, doctors, emergency responders. And we know also in aid work, when we're thinking about this, I really want to invite us to think about, you know, the different colleagues that we have. So some of us may have a lot more access to support and resources than others. And what does that mean? And as Sarah said, we're not just thinking in the guidelines of paid staff, we're also thinking of volunteers, incentive workers, et cetera, who are often the most front-facing people in aid responses and in GBV responses included. Next slide. So we can think of this like, you know, if we think about managing stress, if stress isn't properly managed, this is one thing that can lead to burnout, and it can be damaging not only for the individual, but in GBV programs, you know, we also think about the relationship that some of the frontline staff have with clients or survivors. It can also, you know, not be helpful for that relationship as well. So I would love to talk to you, spend the next time talking with you about, you know, a few different types of stress and ways to manage that. Next slide. So this slide has some animation. If we can just hit next. So one type of stress is day-to-day stress. And that's kind of like the normal, you know, you're in traffic, you're frustrated by that, you know, different difficulties in the household, that kind of stress. There's often also something called cumulative stress. And this is something where a number of stress factors, such as heavy workload, poor communication, coping with situations in which you feel powerless, the inability to rest and relax, those things accumulate or build up over time. And that's a common experience. Cumulative stress is very common for people who work in chronically stressful situations. There's also critical incident stress. And this is when, you know, there's some kind of incident that occurs.
Mais lié aux incidents, par exemple, quand on a, ça peut être,
you know, something like that occurs, and there's a stress associated with that specific incident. So we're going to focus for the purposes of this presentation on cumulative stress. And just to emphasize, I'll share some, you know, general examples, but each individual experiences stress differently. So, you know, you might want to add to this list or take away from it. And I really invite you to take some time to reflect on these things for yourself. Next slide. So the first thing is, what are your warning signs when that stress is really building up, when it's accumulating? I've included a lot of examples on this list, and I just want to acknowledge a lot of this draws on different materials that, you know, when I was managing GBV programs for IRC, many of us were sharing these things with each other and however we could, right? Because there weren't that many there wasn't a lot of guidance or tools available. So just acknowledge this is building on years of GBV staff sharing with each other and trying to support each other. Look at some of these examples. So increased fatigue, avoidance of social situations, nightmares about GBV, feelings of isolation. You'll see the second bullet on the right side, the absence of supervision and debriefing. So we have another speaker that will speak to the importance of supervision. Again, I think these slides will be shared, the recording will be shared. Take some time, maybe list out your signs and potentially even share that with either a close colleague or friend or somebody that can also help you notice when these things are happening. Because I think many of us can speak from experience. It's not so easy, you know, once you start to feel all of these, to be able to kind of note that for yourself, wave that red flag and say, okay, something's going on here. I need to step back and access some support. Next slide. So this is a great tool, again, something to look at with a bit more time later. This is coming from the New York State Office for the Prevention of Domestic Violence. It's something that we used a lot in our trainings with caseworkers, and it goes through the emotional response that, in this case, they use the term victim, people also use the term survivor. So the victim or survivor's response, and then the caseworker's response. And then what one can do for the survivor and for yourself. It's a really great tool, again, that could be expanded upon or contextualized where you work with your team. If we take just one example and we look in the middle row of overwhelm, the survivor may feel overwhelmed by lack of options or the inadequacy of the resources available, or by their feelings of terror, rage, or helplessness, or the urgency to change so much about their lives. At the same time, the caseworker may feel overwhelmed by some of the same things. Again, the inadequacy of many of the options and resources available. They may feel overwhelmed by hearing so many painful, scary stories, or by anxiety because they can't control the client's fate, and their client's safety is probably questionable in many cases. So what can that worker do in this case for the survivor they're working with and for themselves? So it has some examples for the survivor of helping to mobilize a support network, helping her to prioritize and focus on safety as the primary concern and articulate goals and point out personal strengths. And then for themselves, establishing realistic goals, trying to determine limits and personal needs, talking out feelings. And again, there's safe, supportive ways to do this, especially with confidentiality that we'll probably hear more about in the supervision conversation. Checking out expectations for oneself and their clients, and using support networks for themselves as well. Next slide. There's a particular term, and this is covered in the minimum standards as well, vicarious or secondary trauma, which also is typically a cumulative process, meaning it builds up over time after prolonged exposure to other people's suffering. So that's something that many GBV staff in particular, because of the types of issues we work on and working really with individuals in some of the frontline roles, but even people who might not work directly with survivors may think, well, I don't have vicarious trauma, or I don't have secondary trauma. I'm not doing that work, or I'm not doing it anymore. But really, even just reading and hearing and working on these issues can bring up vicarious or secondary trauma. SBRI has a great resource on vicarious trauma for researchers, for example. Next slide. So we talked about knowing your warning signs. The other half of that is knowing your needs. So what are your signs that you're getting stressed and need a break? What do you know you need to have in your life in order to cope with stress? I'll give an example. It's probably, everybody has all these wonderful things that they say they do every day. I found, especially when I was moving around and working in emergency responses, the one thing I could do was try to bring either, if I could access fresh lemons or bring lemon juice, I get up in the morning and I have hot water and lemon. And it's a very basic thing. I'm not a morning person naturally, but it's one thing that helps me to have a check-in moment at the beginning of the day. That's a very small example. And there's many more examples, but just it can be anything. I do want to bring us next slide, just to, also step back and consider we're all living through a global pandemic right now. So, some of us, this is a picture obviously of someone on Zoom, like next to their bed. Many people are working in different conditions. Many people are trying to care for their children and their families, maybe elder relatives, extended families at the same time as they're expected to keep working. I think if you're not stressed right now, that you might, that'd be very unique, right? So it's reasonable to be stressed in these conditions, and a lot of the things that we're sharing, especially for people still working in the field, they might not be able to access R&R or breaks or travel to family as easily. So what does that mean in these current times, and considering that as well? Next slide. So we'll just end with a few reminders and tools around stress management. For GBV staff, we're often used to training and just sharing with others around the multiple aspects of a person and how gender-based violence can affect the physical, emotional, psychological, spiritual, social, intellectual well-being of survivors. And these are all aspects that we hold and need to maintain as well in our aspects of our own well-being. So a lot of things that we can maybe think about are ways to exercise or eat or rest or relax that are reasonable for us, right? And useful for us. That might be some stretching, or that might be some food that comforts us. But again, take some time to reflect on this. The next slide has an example of a form that can be used. You can modify this and use this with your teams to help brainstorm and think about what are some of the plans that we can put in place to take care of ourselves, but also each other. What are things that we can do not only for ourselves, but things we can do as a team that help to support well-being? And I'd really like to emphasize And we'll kind of end with this. A lot of the self-care, staff care, it almost isolates it as an individual responsibility, and it's not, right? I mean, Sarah talked about duty of care. The GBV Minimum Standard 3 highlights the critical role that leadership plays in creating an organizational culture that prioritizes staff safety and well-being. A lot of choices staff can't make for themselves. They need management and the organization to support. So next slide. You know, we see a lot of things about beating burnout. This is one quote that talks about the importance of balance. So they say, you know, I would sum up the advice about how to beat burnout in one word: balance between giving and getting, stress and calm, work and home. And I will be honest, I have found balance really unrealistic. I think especially when you're working in emergencies, it's hard to be balanced, right? So, you know, strive for that, and maybe it's rethinking, what does that mean? What does balance mean in our field, and how can we support each other, right? Because I think it's especially hard if we think we alone have to find our own balance and have to make it happen. That's not true. We live in bigger structures and systems that make it easier for some of us than others to access that. If we think about, you know, racism and patriarchy and everything else, and also just the very real organizational structures that we live in. So I wanted to close, next slide, with a quote from Yashnamaya Padamsi, who wrote this a few years ago, actually, on her blog. Just hit the, there we go. So we'll go, it's a kind of a big quote. We'll go through it piece by piece. Too often, self-care in our organizational cultures gets translated to our individual
Les organisations, les cultures, c'est traduit à la responsabilité individuelle.
Bath, go to the gym, eat some food, and go to sleep. So we do all of that self-care to return to organizational cultures where we reproduce the systems we're trying to break, where we are continually reminded of our own trauma or exposed and absorbed secondary PTSD, and where we then feel guilty or punished for leaving work early the night before to take a bubble bath. A liberatory care practice is one in which we move beyond self-care into caring for each other. And then this ends with, you shouldn't have to do this alone. So I want to end on that note, and the next slide shares a few resources that are highlighted in GBV Minimum Standard 3, as well as a blog from the Coalition of Feminists for Social Change about reclaiming our self-care as a feminist act. That's a great read with a lot of great links to other resources. Thank you all very much.
Thanks so much, Elena. Always so inspiring for me. And next, I'd like to turn to Deirdre Campbell, and she's going to talk to us about a really important concept I think is sometimes misunderstood, the concept of supervision. Over to you, Deirdre.
Thank you very much, Sarah, and thank you very much, Elena. Really helpful. Good afternoon, good morning, good evening, wherever you are in the world. Greetings from a bedroom in Ireland today. So my name is Deirdre Campbell, and I'm currently working with Trócaire. I've worked for 15 years dedicated totally to gender-based violence, and in different roles, but about 8 of those years have been in direct frontline supports, face-to-face work with survivors. So I'm going to share a little bit of my learning from over the years on supervision, a little bit of a reflection on what it's meant for me, and see, you know, I suppose support us to kind of build a bit of a shared and common understanding of it. So I'd be interested at the outset of this to invite all participants or panelists to use the chat feature and just put in words that come to your mind when you hear supervision. What comes to mind? If you just pop in the words. Management is one word that comes to mind when we hear the word supervision. Support, case management, listening, monitor, training. Yeah, quality, direction. No one ever taught me how. Interesting. Oversight, personal development, HR, critical thinking, insight. Great. So fabulous. Still loads coming in there. Guidelines, leading by example, debrief, technical support. Thank you so much, everyone. So I think what we can do, psychosocial space, support and sharing, structured plan to support. Yeah. So I think what we see there very quickly is a lot gets packed into supervision, and it can have different meanings for different people. When we engage in it, we may be looking for a specific thing from supervision, and sometimes the supervisor may have the same idea of supervision, or their idea of supervision may differ to my idea of supervision. So I think that's really, really important when we start talking about supervision, that we're kind of build that shared understanding of what supervision means for us. And obviously it may look and feel different in different settings, for sure. But essentially, when we look at the minimum standards, we see that supervision is about supporting GBV staff to continue to build capacity, practice safely, and maintain well-being. So this idea of well-being coming into the support piece, the structured plan, the case management. So there's lots in it. I think Alina's presentation has set up really clearly why all of these elements of staff support and care are so important, in terms of there's like self-care, collective care, and there's duty of care, and they're all interacting. And sometimes they're in the one space and sometimes they're in different spaces. But because of the unique challenges we face, they're really, really important. I think some of the challenges with supervision, based on my own experience and reflections, and this may resonate for some, there may be others that you've noticed as well, is that it can be maybe undervalued, thought of as a nice to have, but not an essential. Maybe thought that line management provides this fully, but maybe in experience, the line management support and supervision is very administrative, and it doesn't have the holistic support piece in it. And sometimes one of the core challenges to supervision is that there's no money, it's not funded, it's not written into the budget in the programme, and we're trying to fit it in at times, and this definitely in our experience has been challenging. I guess overall with supervision, it's about remembering that no one size fits all. It can look and feel so different. Some examples, if I try to categorize what supervision might look like, I kind of think of administrative supervision. Maybe that's my line management. It helps me to checks in on my workload, maybe helps me to debrief on the workload, maybe a bit of a surface level check-in on stresses, a bit of performance management. And it's kind of focused on organizational accountability. Some supervisors or line managers, in my experience, have deeper skills where they come deeper, they come with a background in GBV, but not always, and can support a little bit deeper on it. But at times, in my experience, line management has been very administrative and less supervisory or supportive. So if that's the case, then that needs to come from somewhere else. Another place where I've experienced supervision quite clearly would be kind of within the frame of case management supervision, which revolves around case discussions, mentorship and support around case management, some psychosocial supports within that, and it's about building competencies and skills, goes a bit deeper than your administrative level support and supervision, and is very practically focused. And if I was to kind of think of where the flow of accountability goes, I kind of think it goes to the survivor. It's around quality of our work with survivors. It's around having a space where I can tease out challenges I may be experiencing in relation to particular cases. And get maybe an objectivity that sometimes I might lose when I'm deep in there with a survivor managing the case, and really, really valuable for that. Objectivity is so, so valuable. Another space where I've experienced supervision in the past is, I suppose, maybe just to say on case management supervision tends to be internal. So somebody who's GBV specialist within the organisation, they have access perhaps to the case files that we're working with. and therefore can really provide that work support. Another form of supervision that I've had in terms of in different roles is what I would classify as kind of the external supervision. And it's come in different forms. Sometimes it may be case management support by an external person, where I would bring the challenges from the cases. So they wouldn't require all the case notes and the challenges that there might be in sharing that information, but they would help me problem solve in terms of what I'm working with. But also, I think learning and reflection are the two key words that have come up for me as I've reflected back on supervision that's been really, really impactful. A space that I can be in, I can be in conversation with another person, where I can hear myself thinking through things, I can reflect on my experiences, and begin to see them maybe in a different way, draw different learnings from them. And I see this type of supervision at times as kind of being accountable to the practitioner. That's where I see the accountability flow going. So to me, as a practitioner, it's very much around supporting me and creating that support around me. In reality, these types of supervision don't tend to stand apart. And what I would suggest is that they weave together. And they may all happen within the one space, or I may draw them from different spaces, depending on what the context of my work is, and the context of my organisation and what's in place for me as a practitioner within that. And I suppose as I started thinking into the presentation today, I found myself scanning back on 15 years of practice, on the different experiences of support and supervision, and thinking of that and tracking when I felt most well or least well in my work, or maybe somewhere in the middle, which is usually called grumpiness for Deirdre, that low end of the things are starting to get on top of me. And what I really, really draw out from that reflection over time is that I have definitely can track my most well moments to roles where I had structured support and supervision mechanisms in place. And I think that that's really, it's really important, because I think it speaks to the value of what is sometimes undervalued. And I see comments coming in there around the budgeting challenge and needing to advocate for this. And I think absolutely we need to advocate for this to be core to all of this work, you know, and core so that we rebalance that expectation of self-care and duty of care. The expectation for us to stay well ourselves within a system that doesn't promote our wellness or support that wellness. Maybe we're understaffed, we're under-resourced, so it's like we're double jobbing. And you know, in those contexts, when I scan back over my own experience, what comes to my mind is that feeling of, please stop telling me to look after myself when you expect so much from me. It's just not possible. You know, and that's going to push me into frustration, which is further down the line from grumpy. If my colleagues see me getting grumpy, they'll flag it to me. If they see me getting frustrated, they need to be stepping in a little bit more because that's heading towards the burnout end of the spectrum. You know, it's so important that we get the systems in place. So maybe then just to maybe reflect for a brief moment on some of what I think I gained from supervision, and we can open this up a bit more in the Q&A if people want to think about it more. But I mean, I suppose what I would, you know, encourage us all to do is to think about the value of supervision. And I guess the value for me in supervision, wellness. But what was within that wellness So I kind of try to think of the skills I feel I developed through supervision processes. And when I jot them down, what comes out for me is the skill of listening, a skill that we use in our work every day, a skill that's core to survivor-centered working. But not just practicing listening. In supervision, I experienced being listened to, and that was hugely powerful for me as a practitioner. Objectivity is another skill I feel I developed a little bit deeper through my supervision spaces. Again, a skill that's core when we're working on GBV and working with survivors. And the other two skills that really come across to me is the power of reflection. And reflection not just on my practice, which is really, really important, but self-reflection. Reflection on how am I? How am I in my work? How is my work impacting on me? Where does my work start and end? And where is my life starting and ending? And how much of it am I carrying from work into life? And where is that impacting? And I guess that reflection then really building to self-awareness. And these skills have been hugely powerful for me in my practice, but also in my life. In my personal life, they've been really, really valuable. So I suppose maybe to sum up and to pass over to our next speaker, I would suggest that there's three core elements to supervision. And I draw this from the work of Michael Carroll, who's worked as a supervisor in clinical support and supervision for many years and has written much on the subject. But what he would talk about being formative, so supporting, examining the quality of practice and accountability for that practice is a formative form of supervision. But then there's also restorative elements to supervision. And these are the elements that support well-being and coping strategies in relation to our work and lives. And then there's transformative elements of supervision. And these support us to continue our learning and the translation and application of that learning back into practice. So that these elements in a sense are engaged in a bit of a dance within the supervision space. And when they talk about supervision, I think of it as a conversation, a space of conversation. And I'll finish with this quote. Two people are talking, an ordinary room, ordinary people, but this is a special conversation. They are not alone. They are alone, sorry, yet nothing could be further from the truth. The conversation provides a platform for hundreds of other presences to move into, through, and out of the room again. Who is being talked about? How are they being talked about? What will happen to the talk after? Will it remain just words, or will words be translated into actions that affect the person in the space, the persons being talked about, and the systems of which they are a part? So again, drawn from Michael Carroll, but just, I think it sums up what supervision is for me. So thank you very much. I hope that's been helpful.
Thank you so much, Deirdre. Lots of good things to think about. And I look forward to continuing this conversation in the next year. Next up, if you could advance the slide, we're going to hear from Erin Gerber. Erin's going to talk to us about Myanmar and the Pacific. Erin, are you able to unmute?
Yeah, thank you. My internet connection is a little unstable, so I hope you all can hear me. Just feel free to flag me if I'm cutting out at any point.
Great, loud and clear. Go right ahead.
Great, thank you. Yeah, so my name is Erin, and I'm a mental health and psychosocial support specialist with UNFPA working in the Asia and Pacific regions right now. And I've been working in humanitarian aid and development mainly in emergencies for about 12 years in 9 different countries. And I'll be speaking specifically from my experience in Myanmar and a little bit about the Pacific. We can go to the next slide if you have it. Great. So I'll be talking about this document in particular. It can be found on pages 302 and 303 of this handbook for coordinating GBV in emergencies. This was put together when I was working in Northern Rakhine State in Myanmar in 2017. So I had arrived to respond to the security operation that took place in October 2016. I arrived actually the year after that, May 2017, after Cyclone Mora hit. And UNFPA set up a mental health psychosocial support network to support health and protection actors who were receiving GBV disclosures from the violence in October. And months later, I think we're all familiar with the security operation that the government carried out that August in 2017, and it destroyed 90% of the villages that caused nearly 1 million Rohingya to flee their homes to Bangladesh. So within days of that operation, all but a few international and national staff were evacuated. And many of us found ourselves in Yangon, meeting again as a mental health psychosocial support network. Myself and another colleague continued to provide remote support to network members that were still in Northern Rakhine. So as we continued to meet and speak with members about the network and what would be most useful and how we sort of adapt at that time, we consistently heard stories about what was happening in their offices and with other colleagues, particularly managers and leadership, that was negatively impacting people's ability to feel settled and to cope. So we continued to take note of all of these experiences and just found that we were constantly kind of giving information about stress and trauma and talking through simple strategies that could provide more emotional and mental stability in the office. But most of us were finding that this self-care that everyone was talking about was only as effective as the commitment of staff care and well-being from our organization. So I know Alina had mentioned this. The members of the mental health psychosocial support network wanted this information to reach their bosses and to be able to communicate their needs in a way that would be heard. So we sort of went through all of our notes from those conversations on the phone and different meetings and compiled what everyone had shared about what they needed and wanted. And so this included comments from Rohingya staff, from staff that are from other parts of Myanmar that had been working there, and from international staff. So there were consistencies, no matter who we are, in this common experience that we had. So we put together this document. It really was a collective kind of authorship. And this was shared with the humanitarian country team, to the heads of all organizations involved in the response. So the document begins with some basic information on trauma and the importance of connection and how to promote connection for teams that have been impacted by emergencies, particularly evacuation. And the practical points that are given throughout the document also give concrete ways that can help ground staff and help us feel in control. So for example, allowing staff to make decisions about their time, sharing information. A lot of times after a big evacuation like this, information control, decision-making, everything gets shifted to higher levels of the organization, and all of a sudden you're kind of cut off from what's happening. And so really giving practical points about how to keep people more connected in that sense. And being able to keep in touch with those who might have been left behind. So really it's about giving people space to sort of process and come together, and really practical points to support each other. So we could go to the next slide. Yeah, since then, this document has been adapted for COVID, but the information and strategies are quite similar with some updates. So I wanted to share this experience in this document because it's representative of other experiences that I've had in other crises. A lot of emphasis can be placed on self-care as if we as individuals are solely responsible for our own care and well-being, but it's really difficult to take care of ourselves working on GBV in difficult settings, and now through a global health pandemic, if we're not in supportive environments. So we could go to the next slide. I work in the Pacific now, where there's a strong emphasis on staff support and caring for each other. I co-lead a mental health and psychosocial support cell or working group. And we've developed a number of tip sheets, information sheets, messages on staff care. But the kind of basic truth or assumption working in this particular context and culture is that we're all responsible for each other. So I don't even hear the term self-care anymore. As we've been putting together these tools to support all the different mental health and psychosocial support issues that are coming up, communities are really returning to traditional communal care practices. So there was one example that came up of just people coming together in their homes with lemongrass tea and sitting on grass mats in front of older relatives and listening to stories of their relatives. And that's just one example. And so as we develop these different documents, tip sheets, tools, we're seeing those being inserted more and more, and people really being intentional about coming back to who they are and to the essence of their communities and how they've come together. And we're certainly seeing this with healthcare workers as well, maintaining communal care practices in their facilities. The emphasis on collective responsibility for health and well-being of others in Pacific Island countries really reminds me of the importance of this within our own teams and among our colleagues, even if our organizational culture is not communal in nature. So I'll just close by mentioning that many of us work in organizations that don't foster this sense of community that may be integral to our own communities or those that we're working in. And we may also find that in the midst of a crisis, we're not naturally getting what we need. And this isn't always intuitive. We may be impacted ourselves. And so it may be difficult for us to kind of bring that to others. But it's important to remember and use the tools that we can to promote connectedness and support for each other, and that we can decide and create this for each other. We can create our own tools if that's something that is part of the process that kind of reinstates that control and promotes healing. So just to remind you, you don't have to be alone. There's others who are probably feeling in the same way that you are and having the same challenges. And there might also be resources within your organizations that you're not aware of and you just have to ask about. So that's all from my side. Thank you.
Thanks so much, Erin. I really appreciate that. And, that's one of the things that we're trying to do on the community of practice is to create a space. So even if, in your organization, you don't have these things, or even in where you're deployed or where you're located, where you're working, that there you can reach out. And we have over 800 people who are on the community of practice. And you can reach out to us and we can try to support you. And all of our speakers today are on the community of practice as well. So please join us over there. I'll shut up for now and turn it back over to Julie Krause, who's going to talk to us now and share us a bit with what NCA is doing.
Thanks so much. Can everybody hear me okay? I know there were some issues with my microphone earlier.
It sounds pretty good from here.
Okay, great, thanks. So speaking of tools that organizations put together, I'm here today to introduce what we're doing over at NCA and So my job title is GBV IE advisor and specialization in MHPSS, and my background is predominantly focused around mental health and psychosocial support programming. Next slide, please. So in order to strengthen NCA staff care and self-care support for our staff, those that work directly with survivors of GBV, as well as women and girls at risk of violence and exploitation, NCA hired a really wonderful team of consultants to develop this much needed workbook. NCA wants to continue strengthening the GBV program staff and self-care work, particularly fitted to a context where external support systems aren't always available. NCA's GBV program includes case management services, clinical management of rape, and MHPSS services. Our GBV programs work in development, humanitarian, and emergency response sectors globally. GBV caseworkers and other personnel working directly with survivors of GBV are often at risk for vicarious trauma, which has already been talked about. Their indirect exposure to traumatic events through firsthand accounts may increase the risk of this. Staff care packages often focus on stress management, learning about cumulative stress, critical incident stress, and secondary trauma, including vicarious means for identifying signs of stress and negative coping mechanisms. NCA has these references included in our personnel management, health, environment, and safety planning tools already. However, having a theoretical focus on stress isn't sufficient, and the workbook that we created aims to create and working towards developing committed leadership towards the same. It was also, sorry about that, a space to transfer a theory to practice. Self-care is everyone's responsibility, and addressing their own well-being is important within a staff care package. Ensuring that each staff has the necessary tools and space to focus on their own well-being, we wanted to support staff in creating their own positive coping mechanisms. The workbook expands on existing reference materials on staff care and self-care, such as the interagency GBV case management guidelines and the Women and Girls Safe Space Toolkit. In addition, we're in the process of working with our consultants to facilitate virtual workshops for our GBV programs, as travel continues to be complicated during the face of COVID for everybody. Next slide, please. The staff care section was designed for staff well-being at NCA. We're encouraging team leaders and managers in our country offices to refer to the staff and this section to better support the well-being of everyone on their staff and create an environment of empowered and engaged employees who can work at their highest potential towards a just world. This workbook is a conscious decision working towards developing committed leadership towards the same. It was also created to be extremely user-friendly. It has sections where people can write in their own concepts, ideas, engage in group and self-reflective activities, and create plans for their work. It's meant to be used and not just trained on and put on the shelf, like too often happens with training materials. Staff well-being is a critical component in achieving the vision that NCA holds for all of its personnel, and it's the responsibility of managers to ensure the space is created and supported for the staff to undertake this self-care. Can you change the slide, please? So sections in this area address organizational culture, including what healthy organizations look like. It also has group activities for identifying shared vision for well-being and looks at creative and supportive spaces through peer-to-peer support. And this would really take a lot of buy-in from the country offices in order to consider setting aside time and space, which is often not always available, right? For the staff to be able to be supported in the best ways possible. Peer-to-peer support is often one of the biggest factors in maintaining well-being at work. Again, some of that was addressed earlier. These networks can be group-driven by the staff, or they may have external or in-house facilitators. And through this, team members feel supported, and they can begin to form relationships of trust and empathy. Another section focuses on building trust and solidarity in their teams, including identifying with others and exploring boundaries. Next slide, please. Other sections focus on compassionate leadership and communication, having staff leaders think critically about how they're listening and the different types of levels that people listen at. This also includes thinking about team check-ins that are genuinely hearing what the team has to say and where individuals are at the present moment. Another section focuses on bringing the team together and building connections, including eliciting feedback from the team itself, rather than just coming from the top down from HQ or managers. It gives several additional suggestions for ideas that teams might not be doing already. Another important focus included looking at staff well-being and resilience and how leaders can recognize and respond to problems within their teams about these issues. Can you change the slide, please? The last section in the staff care component looks at how to respond during COVID, as well as other pandemics and public emergencies. This workbook is meant to live on past the current global pandemic. And unfortunately, with things happening, it's just a mindful approach in order to maintain staff care and self-care. So being prepared to best support our staff during other complicated times, it's really integral to overall team health and functioning. During a public health emergency like COVID, staff care and support should be an even higher priority. It's particularly important to take time to consider the different needs and situation of staff as we ask our leaders to think about staff members who are isolated, living on their own, or dealing with underlying vulnerabilities, staff members who have caring responsibilities in their homes or within their communities, staff who are grieving and might not be able to participate in normal mourning processes, staff who are particularly overworked or overburdened, especially frontline workers, and also to think about taking care of themselves as well. And that's really a lot. Next slide, please. So lastly, I wanted to touch on self-care section that we created. And again, it's very user-friendly, and this is meant for all of our staff within the GBV program. And it's really important, and it ultimately impacts staff care. This section focuses on self-care practices and approaches to use, whether in times of crisis or not. Workers may experience vicarious trauma. Again, all of this was addressed a little bit earlier. PTSD, compassion fatigue, and burnout. The activities in this section were developed for everyone that reaffirm our 6 key principles for self-care that are intended to be used as part of a regular, consistent practice to prevent burnout, vicarious trauma, and compassion fatigue. Some are really creative and require pen and pencil, and others are also just a space for quiet and self-reflection. So that's all from my side. Again, thank you for listening to me about the staff care and self-care workbook that we're developing at NCA.
Thank you so much, Julie. And you were one of the inspirations for this webinar. When we heard that NCA was putting together this the staff care book, we wanted to be able to start looking around to see what else everyone's doing. So thanks a lot for sharing that. Next, I want to ask Virginia to come and talk to us a bit about what kind of tools we can find in the case management guidelines.
Thank you so much. Just confirming, can everybody hear me?
Yep, sounds loud and clear.
Great. So hi, everyone. It's such a pleasure to be here with you today. My name is Virginia. I work with UNICEF, and I've been working on the GBV IMS global team. Many of you may or may not be familiar with the interagency GBV case management guidelines. And for those of you that are hopefully familiar with the guidelines and documents, I'm hoping to also point out a little bit that the guidelines go a little bit beyond and really dive into also how to support organizations and staff on building capacity. Yes, on case management, as in the service delivery and how to deliver appropriate case management services, but the guidelines and accompanying training materials really also dive in to the importance of supervision and staff care when it comes to GBV case management programming. That was a really interesting presentation that Julie just gave on a NCA specific tool and resource, but so often we hear about organizations that don't have specific policies or protocols or training materials or tools or resources dedicated within the organization around staff care. And so one place that you can turn to look, if you haven't already, or if you didn't already know about it, is in the interagency GBV case management guidelines. As we've sort of heard from several of the panelists today, organizations and supervisors within those organizations really play a critical role in creating that organizational culture that prioritizes safety and well-being of staff. It was wonderful to hear this. I think almost every other speaker that presented today highlighted the fact that we used to focus a lot on self-care, which kind of put the burden on individual caseworkers or individual staff to take care of themselves. And really what the guidelines try and do, which seems to ideally be becoming more of a norm nowadays, highlight the fact that really this is a communal responsibility. It's certainly a pivotal role of supervisors, as we heard from Deirdre, but it also is really about organizational culture and organizations ensuring that they're prioritizing that. And of course, this is particularly relevant in our field of work, whether you are work in the humanitarian field, more at large, specifically in emergency response, but as Alina highlighted, especially if you're working in GBV, because of that high exposure and risk of vicarious or secondary trauma. So really just to highlight that integrating staff care is a vital component of supervision, and it's really important for organizations to ensure that they have policies and protocols in place that ensure considerations for staff care. Those are integral components to GBV case management programming. Thanks, Shiva, for moving to the next slide. So if you're not already familiar with them, the Interagency GBV case management guidelines are a beautiful resource that sort of dives into supervision, as well as has a section on staff care. Chapter 2 is dedicated to supervision, and staff care is embedded within that. And what many practitioners that I've been exposed to, especially in the last year and a half, as the GBV IMS Global team has been implementing a project that has focused around rolling out, in essence, these guidelines, is that a lot of practitioners are not familiar with the fact that there's an entire accompanying training package that accompanies the GBV case management guidelines. The guidelines and training package are fully available in Arabic, English, and French. So this is not a resource only in English. We are working on Spanish and Portuguese. And then of course, I know that there are many other languages that would be of need to make this even more accessible, but it's a start. It's at least a start. So the guidelines were released in 2017. They do really provide, they set kind of interagency standards for providing care and support to GBV survivors with a focus on the GBV case management process. So they outline the 6 steps, as well as providing guidance on each of the steps as in a framework. Sort of, there are dedicated chapters to GBV case management responses with specific types of violence and populations. So there's a section on adolescent girls in early marriage. There's a section on working with survivors with disabilities, IPV, or intimate partner violence or domestic violence. And as I mentioned, most notably, there's an entire section on supervision and staff care, which starts in chapter 2. Shiva, you can go to the next slide, please. So this is just a highlight that is pulled from the section on staff care. And in essence, it highlights some basic tips on how supervisors can promote care with their GBV caseworker staff. Some of this is, I don't want to say repetitive, but sort of mirrors or echoes some of the resources that Julie just highlighted and that we saw coming out of Myanmar in the Pacific. So if you work within an organization that already has some dedicated policies and protocols or is using some staff care tools, I'm not highlighting this resource to say that there will be anything like innovative or wildly different, but in essence, if you're starting with nothing, this is a place where you can start to sort of think about what's missing within your organization. What are some considerations that you can put into place to ensure that you're facilitating everyday staff care? what should supervisors consider? Does their supervision, no matter how they do it, include a check-in component where they're checking in with staff to ensure that staff's well-being, psychological needs, and self-care needs are being met. So this is just the start of a tip sheet. It includes several things that have been mentioned already today. And then what I really wanted to also highlight, and you can go to the next slide, please, Shiva, is that there are accompanying training materials, as I mentioned. So there's an entire module dedicated to staff care, which is module 19. It includes a PowerPoint presentation for you to deliver, to build capacity within your organization around staff care. It is targeted for both supervisors and caseworkers. It goes through both building capacity on how to identify stress and identifying various types of traumatic stress and how they impact you, as well as going into sort of what are some options of things to consider, things to do about it. There are handouts that accompany the presentation that include tools. A handout called Sources of Stress, a stress sourcing map. There's a really beautiful handout that comes from, I'm now blanking, the Huntington Institute, that is a self-care inventory that's kind of like a scoring checklist that can be used and adapted to help check in with staff on where they are and sort of who might be in most need of some attention or self-care, taking a break, or something like that. So it's a beautiful full resource. There is a full module also, which is the module that precedes the staff care module, because they kind of go hand in hand, which is module 18, which is on supervision. It's also a full PowerPoint that you can use to build capacity within your organization that helps address different types of supervision, different methods for supervision, as well as supervision tools, and how integral staff care is to supervision within organizations. So one of the things that I'm hoping is that this, my brief presentation is ideally repetitive, or this is all something that you're already quite familiar with, but just in case you're not, it is a resource that many people know by name, but then don't know all the different nuances that are included within it. And the GBV IMS global team, as I mentioned, has been rolling out these guidelines. So in essence, building capacity around GBV case management across 8 different countries in the last 2 or so years. And it's been a pivotal component of our capacity building initiative to ensure that we're dedicating equal time to supervision and staff care, as well as building capacity on case management service delivery, because really to be able to provide quality services and have a solid structure in place, supervision and staff care are integral parts to a solid and of quality GBV case management program. Again, you can find the full guidelines as well as the full training packages. The training packages as well are available in Arabic, French, and English. So all the modules and all the handouts through gbvresponders.org. And if not, you can always reach out through the community of practice if you're having trouble finding them, and somebody will be quick to reply on where you can access those resources. Thank you so much for the opportunity to highlight these today.
Thank you so much, Virginia, and thanks for getting up early to help us out today. And I do promise that I will try to respond quickly if you contact us to get these resources. And there's a great webinar tomorrow where you can go much more in depth into all the great stuff that they're doing on case management capacity building. Last, but certainly not least, is our colleague from the GBV AOR, Paula Ramirez, and she's going to talk to us a little bit about the work that she's been doing. Paula, I'll turn it over to you.
Thank you, Sarah. I just want to make sure that you hear me well.
Loud and clear.
Perfect, thank you so much. So I'm Paula Ramirez. I'm an MHPSS consultant for the GBV AOR And I'm going to talk to you today about a program that I have been working on for 4 countries, yes, and it's a program where we want to integrate really the importance of self-care, but also with the quality of the work that we do in the field as GBV frontline workers. Yeah, so it's a program that has been designed specifically for GBV MHPSS, or mental health and psychosocial support frontline workers. But before I go into sharing with you about what is it that I have done, yes, I would like for us to just stop for a second. Yes, the 102 people that are here, if it's possible for us just to pause for a second and breathe, and just connect with your breath right now, and perhaps asking yourself how often you have done this, yes, in this virtuality that we're jumping one meeting after the other, one presentation after the other. If we just take time in this moment to make a pause, and again, how often we have done this, how much is incorporated in our habit to really stop for a second. Yes, so just allowing ourselves for a moment there. So thank you. Next slide, please. So this that I'm going to share with you about this program, I would like to share the concern, like what is happening, yes, what was happening at the beginning of COVID-19 as well. And mental health and psychosocial support, GBV frontline workers were feeling exhausted, yes, and we're having burnout, again, mostly under COVID-19. So, and then the other concern was how to improve the quality, yes, of MHPSS service for GBV survivors under the current circumstances, yes. So on one hand, we are frontline workers that need to give a specific response, but then, yes, how do we deal with the exhaustion that we are living with, yes. And so the what I am doing, yes, it's a program that is called Trauma-Sensitive Mindfulness-Based Stress Reduction Program. What is mindfulness? Yes, mindfulness is the ability of the mind to come into the present moment to moment without judgment. Yes, that may sound easy, but it's actually not. Yes, the mind is constantly thinking about the past, the future, about the current situations that we're in, but overthinking about them is something that we call rumination. Yes, we think and overthink. And trauma-sensitive response to including somatic body work and facilitate the experience of the mind suddenly coming to the present. Yes, it's not obvious that we find safety in feeling present. Yes, so there are some tools that are combined so that we can feel more safe, again, in coming into the present and in feeling our own bodies. So next slide, please. Yes, so where and for who the pilot took place. So this was all virtual world, yeah, like from the here through Zoom for 25 gender-based violence frontline workers, yes, from the GBV subclusters in Iraq, Bangladesh, Venezuela, and Nigeria. So there were 25 people from each of these countries, yes. So 25 in Bangladesh, 25 in Venezuela, and yes, so this is where the pilot took place. Next slide, please. So what is the scope of this training? Yes, and I will tell a little bit about it later, but this is a training that is made in over 8 weeks. And I will talk to you about why in 8 weeks. It's 2 hours, one time per week. But the scope of the training is to understand self-care not as a luxury, but as a way to be coherent between what I know and what I am. Yes. Place humanitarian frontline work from the perspective of being human with the right to feel in need of support. Yes, because there's a lot of stigmatization around, yes, like I'm a frontline worker, but I'm asking for support. Yes, but we cannot give of what we don't have, right? Cultivate emotional stability in the mind through the body. Yes, through habit, time, and practice. Imagine that our brain is our huge field, a huge green field, yes? And what happens if every day we walk in the same place? There's a path that will shape, yes? So if we every day wake up being tired and feeling short-tempered and having more and more and more stress, that is what is going to become real, yes? That's where we're going to train. So how can we change that? By being more aware, by being more conscious about our life, our breath, yes, our moment-to-moment experience. That's the way of actually stopping and seeing that the field is actually much bigger. But for that, we need to build habit, yes? I'm sure that many of you know, yes, everything that we have said about the importance of sleep, about the importance of this and that, but how is it that we cannot integrate it in our lives? Because we need habit. Yes, that's why this program is created over 8 weeks. Yes, because it's a time where the mind gets to really integrate a little bit of how is it that self-care makes sense for our lives. Yes. We also recognize the impact stress has in our brain and our nervous system. Yeah, so that we can understand the body and mind connection. We learn and use our social interaction system in order to be present with others. Yes, and this is the part where self-care connects with actually the quality of the work that I deliver in the field. Next slide, please. So how is the format of this training? Again, is 8 sessions, 2 hours once per week. Wait, yes, on each session we have a topic, a mindfulness practice, and a sharing, yes. Yes, so let's, next slide, please. So what are some findings that we have had? Yes, and there is a huge need of support and supervision at the frontline level response, yes. There's feeling like guilt about giving time for frontline workers. There's shame around feeling incoherent between the work MHPSS frontline workers do and what happens in their personal life. There are high performance expectations leading to chronic stress. And in most GBV frontline workers that are women, there is a disconnection with their own overall health, menstrual health, and cycle. This is what we have found. So yes, what I really wanted to underline here, I know that the time is short, is just the importance of creating habit. Yes. And this is what we've been doing with this pilot program in these countries. So thank you so much, and handing it over to you back again, Sarah.
All right. Thank you, Paula. Thank you so much for that. And again, you guys, if you go to the AOR website, there's some great videos, including one, a couple by Paula on helping us with those breathings. I really needed that breath. I have been on Zoom all day. I think I'm on hour 9 now. So thank you for creating that space for us. We're going to go for another 5 minutes just because we started a bit late. So I hope some of you can join with us. I wanted to ask, there were a couple questions in the chat. One of them was about advocacy, about, talking about creating the money and the funding so that we can have programs where we provide supervision and we provide support to our staff. I was wondering, Alina, did you have a few comments on that, and any of the other panelists as well?
Sure. Yeah, one thing that comes to mind actually was when I was working in Lebanon, which I'm still doing, but at the time with UNICEF, we looked across case management agencies to develop an indicator around client caseload that was a traffic light indicator. So basically we were looking at both in different parts of the country, but also across different organizations. If somebody is kind of in a certain range, then we would say they were, green light, which means it's a good client caseworker ratio. If they're yellow, there's probably some need for support. And if they're red, it means that the caseload is really high and there's some need for immediate support. And that was a way to do it, where we're not disclosing specific numbers of survivors or cases. That's why we have these ranges, and it's a traffic light system. But it was really to advocate both within individual organizations as well as a sector for where we need to hire more staff. And I think that really gets to the issue of double and triple hatting. So that's one example that immediately comes to mind. I think also, making sure that there are staff in management positions who understand the different roles. And I think that can even be just some things I've done in the past is kind of just quick, conversations when I can, or in management meetings, to really, share out, like, coordination isn't just an add-on where you go to like one meeting a week, and that's it. It's really a skill set. It takes a lot of time. It's an additional burden. And not to say it's burdensome work, but to say if somebody's also managing GBV programming and then also expected to coordinate, that time and effort needs to be accounted for. So I think maybe those of us who've had those conversations or currently having them could share some like key talking or advocacy points through the COP, and maybe start to develop a little bit of a briefing note that staff can use when they have that 5 or 10 minute opportunity to speak at a senior management meeting and really want to get those points across clearly.
Great, thanks for that, Alina. Any of the other panelists want to weigh in on that? And, on the COP, we have done things like this. We work really closely also with the help desk, and we were debating on the COP at one point about how to work with donors so they can better understand why we don't give them all the numbers of survivors that we're seeing. And so we developed a advocacy toolkit, or not toolkit, but a sheet out of that with the help of the help desk as well. So if you have questions on things like this, you're probably not alone on that. And, we can try to find tools for these. Okay, any of the other panelists? All right, in that case, can you move to the next slide, Shiva? Deirdre has kindly given some information about the supervision in the chat box there. We're running out of time. I'm sorry that we had to start a bit late, and I hope that you were all able to participate through the French and the Arabic interpretation. Thank you so much to our interpreters for all your hard work. We can't do it without you guys. Thanks to Shiva and to Philippe for managing, the technical backside and helping support with everything. You guys are a great comms team at the AOR. Thanks to Virginia for double hatting as a presenter and an IT specialist today. And thanks to all the presenters for sharing your wisdom and your knowledge and your support. I find this such a great space to sit and to think about these things. And thank you guys for your attendees for joining us and asking your good questions and just being there for us. So good luck with your work. It's been a tough year in 2020. So do something nice for yourself. Go watch one of our nice little videos about helping you get rid of some of your stress. Come join us in the community of practice and talk to us and tell us what's going on with you. And we look forward to seeing you at a couple of our next events in the next 2 days. Thanks so much. Hope to see you again soon. Bye-bye.